Okay. Today, just I discuss about something corporate hospital. What is for corporate hospitals, and what is the main feature of the corporate hospital, and what is the role of the hospital manager at all? Like what actually they do. Actually, what is the corporate hospital? It's a big hospital referred to a large professionally managed, and it's basically the commercially activity is there, and that is profit oriented healthcare institution, and they covered under the company act and operate on the commercial and the managerial principle of property management. But their business acumen also being taken care of very well. And same time they use or utilize the expertise courses. They are just coming up and the booming up. A lot of corporate hospital they are keep on coming. So that is the corporate hospital basically, there, which is the multi specialist facilities. So registered under the company act, commercially, very commercially, very much oriented. Manpower is high skilled manpower, all that kind of thing. And they differ from the traditional charitable or the government hospital because they focus on the same thing. Profitability is the main thing. Efficiency, they work on the efficiency also. They take a lot of care for the quality patient. That's why all these big corporate hospital, most of them, they are the NABS to hai. Same times many hospital they are the JCI accreditation also. And if we talk about the in the technology aspect, there are latest cost cutting cutting edge technologies. These technologies are available with this corporate hospital. If you talk about the robotic and the artificial intelligence and all that, many hospitals they have already started utilizing all that. And specialization, they are specialized in not in the specialist, or they are super specialized, and sometimes there may be the upper level of that. But the people is very doctors, the doctors who are available with the corporate, they are very highly specific specialized person, and very efficient person. They make their much more focus on the human resource part. That's why. And if we see the why, as since beginning, it is not like that the corporate hospitals were there. Over a period, these corporate hospital culture they came into the existence. People started liking that, and many more players they just came into this field by seeing the profit margins, by seeing the economic or the financial viability, as well as the huge profit from this such kind of hospital. And these hospitals are because the change in the thought process of the people. Same time, their paying capacity increases. Lot of financial protection schemes are there. Otherwise, initially when these all of things were not there, then mostly people they were utilizing the public health facilities. Means they don't have to pay any from the pockets. Okay. So if we see pre 90s, 1988 की बात हम कर रहे हैं. So basically, healthcare dominated by the public sector, as I told you. Most of the people they go to the government hospital and take the care, and many charitable hospitals also, which are being run by some trust or some kind of NGOs, and very less private investment. Doctors were there. Doctors are there. They are running some small kind of clinic, some small kind of nursing home, one or two bedded. But this corporate they are just coming up. Now you take you can take the many more in terms of the hospital, Yatharth Hospital, working on the corporate hospital. Then they are bringing in the most people. They're liking to work there. Now, one of the most important sector is the insurance sector, financial protection. During these which actually requires a lot of fund. So that investment, foreign direct investment, is very much required, and which has been liberalized. And because of that, lot of people they came into this field. Okay, and now 2010 onward, again the progress is going on. Now we are in the technology era. We are utilizing the lot of robotic surgeries in many fields. Now we started using the artificial intelligence also. We started augmented AR and AR, augmented reality, or all that kind of things. We have already started in the hospital, and the telemedicine, that is one more concept which has been just picked up after this COVID-19. So, and financial protection also, insurance, lot of good insurance changes they are coming up, and many more diseases they are covered under. Initially, insurance company they just avoid to take any kind of patient who is suffering from some chronic illness kind of thing, BP, diabetes, and all that kind of thing. But now, because of this insurance regulatory department of India, administration of India, IRDAI, they just make their guidelines, and now they told you have to give the insurance to all these people also. Even the now age criteria is also being somehow what diluted. Now the person who wants the insurance, they can get the insurance with different kind of underwriting. Underwriting is a technical word which is utilized in the insurance sector. When the policy premium and policy condition and all that kind of things is being written by some kind of person, and in the insurance sector they are actually called actuarial scientists. They are the person who are framing the different kind of insurance scheme. So they are actually called the actuarial scientists, and they are underwriting all these kind of policies. So finance is the one big thing, change in the thinking of the individual also. Now people are much more aware about their healthcare, and they just want to take best of the facility which is available in the country. So that is the you can say how this corporate hospital they are just came into the existence. Now we talk about the key features of the corporate hospitals. Ownership management, that is very peculiar. Any corporate hospital, they are not being managed by some single person or some kind of lala kind of person. It is always managed by some corporate entities, business groups, and the investors, and it is managed by the through the board of directors with lot of professional administration administrators and all. It is not being managed by the single-handed. That is the beauty of this corporate hospital. Then the profit orientation, financial sustainability and return on investment is a key focus area for this corporate hospital. So who are the person in the management or senior level management or and all that, they always keep this financial aspect in their view. It doesn't mean that they are compromising with the patient care or something like that, but this is the very key area. Whatever the investment they do, they want some kind of positive return on that investment. Okay, and they are diversified their services also for the revenue generation. It is not like that they are just working in a single location. They diversified themselves. They are going into a lot of things, diagnostic services, pharmacy. Even many corporate hospitals, they have started their pharmacy business also. Surgeries, specialized surgeries. Uh, they also started working with the medical tourism, attracting the foreign person to get the surgery done, and the various wellness kind of program, which is in the nature of the preventive or in the primary healthcare kind of thing. So this is some important features of this corporate hospital. And third, I told you they are very technology driven, very technology intensive. Whatever the technologies which just came into the existence, the corporate hospital are the hospital who just grab them at the initial level, and they start utilizing that. Okay. And most of this technology, they are being captured by the big hospital, and who focus on the tertiary or the quaternary kind of care, means organ donation, organ transplantation, and all that kind of thing, which are considered from tertiary to quaternary care. So that kind of function, the hospital who are performing, they are very technology sensitive kind of people, and they immediate they try to procure the technology and utilizing for the benefit of the patient, same time for the profit of the organization also. Then human resource structures, uh, as we discussed, they just acquire, they just manage to get acquire the highly specialized doctor on the contract or the revenue sharing basis. These are few models when you work in the hospital. One is the contract, and second is the revenue sharing basis. And many corporate hospitals, they believe in this revenue sharing basis. Means the more you work, the more you get kind of things, and after a certain limit, you will start getting some extra amount, something like that. So that model is there, and whatever the administrative functions, they are being managed by the highly skilled administrative people, mbas, mhas, all that kind of thing. Otherwise, initially concept was something like that: the doctor who is working from last 15 years to 20 years in any field, they are considered as ki they are a good administrator or something like that. But believe me, it is not like that. And actually, that's why these all technical kind of courses just they came into the market, and they are very technical kind of course. Even one thing is also there. If you talk about the armed forces, they are considered as a very good manager or something like that. But if you ask the technical aspect, technical thing is something different. They may be very disciplined. Main thing is which differentiate from the armed people, Indian armed forces people from the others. That is the punctuality and the discipline part. They are so much, and these two qualities make the people very you can say uh, very much uh, very much um, um, having that kind of feelings to acquire the very specific kind of things, or they become very target oriented kind of person. They every time they have some kind of view or the vision on that, whatever the object and whatever the objective and whatever the targets of the organization. And then you have such kind of motivation to keep every time your eye or all the actions you whatever the actions, whatever the decisions you are taking in the hospital, that leads towards your objective of the organization, automatically you are going to get a good result. And team building capacity, that one more thing that is very much required in the human resources structure. You have to some kind of team building spirit or something like that. You should be aware about the team motivation skills and all that kind of things, because every motivation methods or every motivation technique, that is not going to work for everybody. You have to, as a hospital administrator, you have to decide which kind of motivation training, which kind of motivation skill, or which kind of motivation theory will be work in your hospital. In your hospital, even with the different group, you are supposed to utilize different kind of motivation skill. Okay, so that's why it's all the part of the hospital administration subject also, motivation and all. And there, as a, when you read the theory, you just feel like that it is a theory part. But believe me, when you start working in the hospital, at each and every step, you just see what about where these theories they are implementable, they are being translated in the ground. That is the very fact thing. Otherwise, until unless you don't work in the hospital, you never come across whatever you have read in the book. They are actually very very real things, and they are being translated on the ground also, and they are giving the result also. It's all dependent on the manager who is managing, who is the leader of the organization, what is vision of the organization. These are all the something attributes of any organization which decide all these kind of thing. Then patient basis, the corporate hospital normally they keep focus on the upper and the middle income groups. As you know, the cost intensive, it's a very cost intensive kind of organization where the cost factor is very high. So of course, only the upper class or the middle income group, who are mostly they are covered from some kind of insurance scheme, or they are impaneled through some kind of government scheme. That 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 person or that individual only can avail that kind of facilities. Okay, there may be dispute, or there may be scope of discussion on this aspect. Should the corporate work only for the upper and the middle income group? So that is again a discussion topic. You can think upon that whether it is correct, or there are certain pros and cons of everything. So you can think upon that. Second, these corporate hospital, because of their technology, because of their expert doctors, expert human beings, and very much quality oriented, they are very successful to attract the foreign patient. And many patients they are coming to these corporate hospitals, and because of that only the economy also grows in the healthcare sector. And a few hospitals, we talk about the Chennai Apollo, that is one of the most one of the hostel which is attracting most of the foreign peoples. And after this Chennai, then we can think about this our Delhi area, Delhi NCR capital, which also attracts a lot of medical to patient as a medical tourism. And two three things which attract these tourism, medical tourism, foreign person, even with the so much of cost intensive, technology driven, whatever the things are there, even whatever the cost they are taking from the foreign patient, that is far far less. They are very lesser from the other countries. That's why people wants to come to this place. In the dental, we just we are doing some kind of survey or some kind of study for just two tax section. One people he just came from some Gulf countries to India for two tax section, and believe me, he was even happy with that. Uska the whole ticket, everything, accommodation, and all that part, that is being covered. Because whatever the maximum cost has been taken for dental extraction, that was far far less than below from his country. And with this monetary gap, he managed to get his ticket, accommodation, and everything, and stayed in the India also for a few days as a tourist also, and then they went back. So that is the cost difference. And there is no question of doubt that Indian healthcare, they are claiming for the best of the quality in the world, and not only claiming, that is the reality also. ठीक है, lot of incidents we listen, will heard कि ये हो गया वो हो गया, but technically in terms of the quality, we are very very quality driven kind of person. So we are mixing of this quality as well as competency of the doctor, as well as cost factor is also there. So we are able to manage that, and that's why a lot of people they are coming for their treatment as a medical tourist. And why these uh, corporate hospitals they are coming up, or they are successful? Economic liberalization. Initially I told you, they encourage the private hospital and the foreign direct investment, FDI. Health insurance is expansion. Healthcare protection is a very it's a very vital thing. Healthcare financing, may you must remember, healthcare protection is one thing which can only bring the patient to the hospital. Okay, then public sector constraint. Because India is the most populous country. Even we have a very good kind of public health system, even if we compare with the other part of the world. But because of the population, we are facing lot of inefficiencies. We are facing poor quality in the government hospital. It is not just because people are careless or something like that, but the load, the kind of load any government hospital they are managing, you cannot imagine all that. So with the ratio of a doctor patient and the nursing staff with the patient, which is on very lower side in comparison to the other part of the world, these kind of compromises or these kind of deficiencies, you it's very difficult to ignore. Okay, and because of the cost and the quality of the treatment, clinical effectiveness, and all, medical tourism increased. And because of this medical tourism increase, a lot of other players they came into the market to attract this medical tourism patient, because they give a lot of revenues to them. And most of the time it's revenue is the one thing, but second thing, when they get cured or they get the very clinically effective treatment, they just become a kind of a word of mouth, or they just become ambassador for your brand. And in the other part of the world, they discuss about, they just communicate whatever the feeling, whatever the experience of the medical care in India to the other persons in the other country. And this kind of effect, spider effect, that was for India. And most of the people, many people, they started to coming India. They started planning their treatment in India as a medical tourism. So these are the medical tourism is one very important thing. Tax incentives. Now government they are also started giving some kind of concessions or something like that. In one hospital I worked in the northeast, that hospital was a totally private hospital, and it's a, you can say it's almost like Apollo type of hospital in the northeast sector. And that hospital land was, the whole land was given by the government, donated by the government, and only the hospital was built by a business, big business group who has already have a hospital in 2 3 states. So that kind of concession government is also giving for the benefit of the people from that particular area where the medical facilities are not there. And if you read or if you came across the condition of the medical health facilities in the northeast region is not very good. Even not a good word is a very high kind of word, not satisfactory. People are still facing a lot of problem for getting the treatment for some complex problem or some kind of specific disease for cancer or some kind of kidney diseases. All this they have to travel a lot. And as I told you, the accessibility is the one of the very important thing which enhance the satisfaction, public satisfaction. Until unless the services not are not easily accessible to them, satisfaction is not going to be increased, or that is not going to be perceived on the ground. So uh, these kind of tax incentives and all that activities, government they are doing just to motivate the big players to come into the field and provide the business, or to provide the boost the economy of the country also. And these are certain contributions or the positive aspect we can think upon that. What the corporate hustle, they are able to provide the technology advancement, introduce state of art equipment, advanced clinical procedures. They are much more behind this quality and the accreditation process. And for that, the NABH is there, ISO is there, JCI is there, and a lot of employments they are also generating for the medical nursing and the management professionals. And because we are the management people also, we are the management professionals also, so we can think a lot of management positions are increasing. And that's why these kind of courses, MHA, MBA, and hospital administration, they just came up. Okay, where health infrastructure expanded tertiary care availability in the urban areas. Main thing is that initially, even in the urban areas, this tertiary care facility is not. were not very much easily available. People have to travel a lot. So then medical tourism, we are getting the foreign exchange, and same time, as I told you, we are getting the global reputation also. That is very important thing. Besides so many, we are getting global reputation for our clinical skill and the quality of care. That is very important thing, and they're all being done by these corporate hospitals. So with these plus point, as you know, everything has some kind of lower side also. So with that, they commercialize the actually health. It is one of the serious impact. Sometimes few corporate hospitals, they just cross their line. Because everywhere there is a kind of moral line कि कहाँ तक हमें काम करना है, and over that everything is going to be on the negative side. They start giving profit on over the patient welfare, and start over prescription, over unnecessary kind of procedures, unnecessary kind of investigations or the diagnostic services for just the sake of the generating the revenue. Then biasness is there कि most of the corporate hospital, they are located in the urban areas, and reason what, um, सबसे बड़ा जो इसका साइड इफेक्ट है, because of that there is a neglect of the rural and the underserved area. Why? Most of the skilled people, these corporate people, they attract them. They just acquire them by giving good salary, handsome salaries, and good working condition. So most of the people, they just don't want to go to the rural side, and they are coming to the urban areas. And because of that, rural and the underserved areas or some kind of far-flung areas, they are suffering from such kind of crisis. That is one of the big issue, and how we can address that. We can also think upon that, how we can make the balance between these urban and the rural healthcare services. Then affordability concerned, if you talk about, they are charging exorbitant charges, means the facility visit or some diagnostic test which is being carried out at the cost of 3000 INR, that is going to be approx 9,000 to 12,000 in such kind of hospital. So that kind of difference you may feel, particularly in the Apollo and the other private corporate hospitals. So that charges is also make the other people, lower income people, for them it is not accessible. Even they have a good technology, they are very highly skilled people, and sometimes anybody needs that also, but because of the cost, he cannot afford that. Then ethical issues, a lot of ethical issues are there, which is already been covered in the commercialization part, where when the treatment is actually not required, but for just getting the revenue, you just hyper over diagnose the patient. And medical is one thing which is facing, medical healthcare sector, that is again facing one big job problem, that is the asymmetric knowledge, asymmetric information. पेशेंट और डॉक्टर या पेशेंट या हेल्थ केयर को पता ही नहीं, हेल्थ पेशेंट को पता ही नहीं है कि व्हाट इज राइट फॉर देम, व्हाट एवर द पेशेंट, व्हाट एवर द हेल्थ केयर प्रोवाइडर्स दे टेल द पेशेंट, they have to believe that, even so qualified patient also. And why? Because of that, because patient may be very highly qualified, but in the medical area there is a asymmetry of information. Means information, they are not coming into the market in a very transparent manner. People are aware that there is a kind of PTCA, परक्यूटेनियस ट्रांस कैथेटर जो हम करते हैं, एंजियोग्राफी, एंजियोप्लास्टी इन द कार्डियक केसेस. People are aware, maybe aware कि it's a PTCA, but people are not aware कि which patient they required medicated stent, which patient they don't require such kind of stent, which kind of, in the ortho, which kind of stent is better, whether steel implant is better, or whether the normal cement implant is better, or sometimes the titanium is implant is better. So these are all the information gap, and that technical word is called in the medical setup, or in the even this word is common in the health economics also, that is called as the information asymmetry. That is the one issue. Then regulatory oversight, many times these corporate hospitals, they have good link with the political parties and all that. So many times there is a chance of violation of the various regulatory things, that is this fire and all that kind of thing. And because of that only, many times you heard this news ki Calcutta mein one, there is one big hospital which caught the fire or something like that. So all these fire incidents, they happen most of the time. If you see the previous incidents, maximum time they happened or they occurred in some big kind of hospital where there is some kind of negligence is there, which has been safety point, which has been overlooked by the authorities just because of some tie up with the high political or something like that kind of person. Then the impact on the human resources, which already I told ki, lot of brain drain from the public hospital, but they are able to give a huge amount of money. They have lot of incentive kind of programs by the corporate hospitals. So doctors, technicians, and many skilled people, they just leave their public health services and they come to and join the corporate hospital. Okay, because there is a very lucrative kind of setup is here, where there is a, some life which is very different from when you work in some kind of public hospital or some kind of hospital who is running in the rural. So that kind of brain drain that makes the other part of the system paralyzed. Okay, people are not getting whatever they are supposed to getting. So that fails the concept of the health for all. And why? Because one key feature is, two three key features which are not available. That is, one is the lack of accessibility, then second is the high cost, means financial protection is not able to cater all these kind of treatment or the facilities to be taken in the corporate hospital. So these are some important issues. And how government, they are trying to regulate all these side effect, all these uh, adverse thing about that. They be in between, they bring the policy, national health policy 2017. They enforce the partner to accountability for the regulation and the equity. Then the clinical establishment act, this is important act, and which directs some kind of quality guidelines for every hospital to follow that quality guidelines. Then Ayushman Bharat, they increase the interaction with the private and the corporate hospital through empanelment. All the maximum type of hospital, they are just impaneled with the Ayushman Bharat. So that kind of this thing is there. Then FDI policy, 100% FDI is now allowed in the healthcare sector, which was not available initially. So for because of that, there are increasing the corporatization. There are a lot of foreign companies, they are willing to come to India. They want to invest in the infrastructure, something like that. And of course, most of the manpower that is being provided by the India itself. So that is a very, very profit oriented kind of thing. And these are the few hospitals. Just for your Apollo Hospital, this is the Chennai, and they have created a lot of network across India and the abroad. Everywhere they are just spanning their services. And this is the Fortis Gurgaon. It's a very high-end tertiary care, international tie-up. Lot of medical tourism and organ transplantation activities are being conducted at this place. And this hospital, which is very famous, that is known as the Narayana Hospital, which are famous across the world for this affordable cardiac care model, which has been given by the Narayana Malik, whatever the owner of this hospital. He is basically the cardiologist, and he provided very economic model for the cardiac care for the um, 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 uh, low economic people. And this model is very famous across the world. He has been gifted with a lot of awards and all that kind of thing for generating this model. And then we come to this Manipal hospitals. This is also one big hospital, and Manipal hospital, they are basically linked with the education also. They are providing all sorts of medical education, paramedical education, and same time they are running the hospital also. And nowadays, if you see in the newspaper or in the news, you see Manipal Hospital is the one hospital group which is actually acquiring the many hospital. They have that kind of model if the hospital which is not running in the profit or something like that, they just offer and they just approach and they just acquire that hospital, then they start running that hospital according to their policies and according to their model. So these are the few example. Max Hospital, that is one also hospital. So these are the few examples just make you understand how these corporate hospital they are working in the India. Okay, now we come to the second part of this managerial part. As I told, corporate hospital they are very highly skilled kind of hospital manager. There's nothing like that. One very senior doctor, he is managing the hospital administration. Every time they hire a good hospital administrator with that kind of technical skills. Okay, so who is the actually? If you see who is the manager, manager is a very basic term, and there are three things which are the important part for him. That is the planning, directing, and the coordinating. All these three actions they actually cover most of the activities in any kind of hospital. Okay, and their role ensures the hospital functions efficiently, patient safety, everything should be done in a ethical manner, and same time they also help in managing the financial as well as the clinical goals of the hospital. That is the thing. And now we see the level of that top management. Maybe see the CEO, medical superintendent, director. They are actually the manager, but they are at the top level, so their designation is changed. Middle management, maybe we can see department heads, HR, finance, and all that. And lower operation management level, where we can see the ward managers, supervisors. They are all managing something. That's why they are manager. Only the designation according to the age, according to the knowledge, according to the experience, their designation is continuously being changed. Okay, if somebody at the very lower level and he acquires some kind of knowledge, then of course he is going to become sometimes into the top management also. Okay, so that is the managerial level. If you just for sake of knowledge, then their roles and responsibility, that is important. And the first and the foremost role is of any hospital manager administrator is the administrative and the operational management. He has to or she has to see day-to-day operations of the hospital. They must ensure availability of the infrastructure equipment. They have to make the coordination. That is a very important role. Clinical nursing and support services. Where that coordination is very much needed. Without the coordination of all these three services, you are not able to provide any kind of good quality treatment to the patient. And then they have to see, they have to make the standard operating procedures for various kind of things. And how this standard operating procedures they help, they are certain document kind of things where the everything is written or explained in a manner. Anybody who comes to in the that position, they have to just see that SOP, and the result is going to be same because you are following the same SOP. So whether it may be A person or B person, if they started following this SOPs, the outcome is going to be same. That is the purpose of this SOPs. Whatever the outcome is there, that is going to be same. It should not be person dependent. Anything has to be process dependent. The moment you become make your system person dependent, it creates a lot of problem. You just see in your day to day life. But if you create your function or if you create your management something like that, that is being driven by the process, then the result and everything is going to be entirely changed. So that is why these SOPs are very much required. Then human resource management, it again is very important role of the hospital administrator and the managers. Recruiting, training, and retaining is a big thing because these dropouts are a very very significant problem in some hospital. Then performance appraisal they have to do. Motivation part is that they have to apply all the motivation theories whatever they have been taught during their graduation or the master's courses. Conflict resolution, he must be there. Okay, in the hospital is one where there is a very high chance of conflict between the patient, between the doctors, or between the other staff also. Then continue medical education, CMEs and all that. That is one of the most important activities which is actually mostly ignored, or it's not being get so much of importance in any organization. But if you become medical administrator or hospital manager, my sincere advice is there कि just don't leave the this education part. That is very important. And they're also meant for this teamwork and communication with a multidisciplinary staff. Lot of people they are working in the hospital. They are from the with the different kind of education level, with different kind of expertise, with different kind of experience. So as a team manager, you must know okay, how you are going to manage them people. There may not be a single kind of principal which is for going to work in the hospital. You have to deal with the different kind of people with the different skills, set of skills and different demographic profile. तो एज ए मैनेजर यू हैव टू थिंक अपॉन दैट कि हम किसके साथ हमें क्या करना है या किस तरीके से we have to take work from the other person. Okay, then financial and resource management, that is also one of the part of this hospital manager, and that's why this particular section is included in the various hospital management courses. Okay, they have to prepare, monitor hospital budget, controlling the cost, one of the big issue, billing, procurement, you know, inventory control, and revenue generation, how to hospital should make more profit, insurance, public private tie-ups, CSR, corporate social responsibility is also their responsibility. And then they have to conduct this cost benefit analysis, cause any kind of economic analysis, they are supposed to do that just in the favor of the hospital. Then they are also the custodian of the quality. They must ensure quality implementation, assurance, and the accreditation. And a lot of organizations, NABH, ISO, I already told, monitor infection control. That is again a part of the quality, and use performance indicators to just monitor the quality. You cannot, because monitor is something like it's a subjective thing, so you cannot monitor, you cannot analyze anything which is subjective. Somehow you have to convert it into the data. So these indicators are basically the tools which convert this quality into some analytical data. And until unless you have analytical data, you are not going to come to know the what is going in the organization. So based on the analysis of this data, you get some kind of knowledge, information, and later on that information is going to be polished with some other evidence-based resources or the research activities. Then that information converts into the knowledge, and then after the knowledge, there is again expertise level who just polished or enriched the knowledge, and that knowledge is going to become some kind of research or something like that. So that is the normal kind of development of the data. And foster a culture of continuous quality improvement. Quality is not something like that. Whenever there is some checking or the audit is there, you start maintaining the hospital. It has to become the part of uh, your organization. It has to be go into the detail as a kind of habit kind of thing. Then only quality can be sustained. Otherwise, it's very difficult to sustain the quality. Then legal and the ethical compliance, hospital manager, he is very much responsible for that. He must have knowledge of the various kind of regulations which are important to run any kind of hospital. His responsibility or her responsibility that ki in time you are supposed to get your licenses reviewed and all that kind of thing. That is also the job of hospital manager. And the important thing is that patient addressal, patient grievances and the medical legal issues. And most important thing is that patient grievances must be handled very sincerely, very cautiously, and whatever the decision, whatever the things, whatever the outcome of this grievance redressal, that is also supposed to be communicated to the patient or the patient attendant. Until unless it is not communicated, the purpose of the grievance redressal itself is failed. So it has to be reached to the person who has put some kind of complaint or something like that. And promote ethical, transparent, and patient-centered services. Whatever the business, whatever the hospital, whatever the activities we are doing, it is only because of the patient. So of course, in anything, you must think keeping the patient in the center. then you should take decision for anything, even for hiring the staff, even for the procuring the technology, even for taking any kind of license or something like that. Patient should be in your center. That is the important thing. Then strategic planning, manager has of course he has to do the strategic planning. That planning may be short term, long term, or something like that. So he must be aware how to assess the situation. He should know the SWOT analysis, strength, weakness, opportunity, and the threats of the organization. That is very basic kind of model with, and every hospital manager they are supposed to know, and they are supposed to practice also. Okay, new kind of program, technologies, liaising with the government, NGOs, and these are all the job of the communication and the public relation. It's very important thing. They have to communicate with different sorts of people. They have to make balance between the media relation, hospital branding. This is all very important for this carpet and the other kind of hospitals also. And same time, he has to ensure whatever the trust is required between the different stakeholders, that should also be maintained. Then he has to work with as an information management. He has to see the this health management information system data. He should make the policies so that correct data can be generated, and they can be further utilized for the analysis. And based on the data, evidence based decision can be making for in any area. He should also promote this digital health transformation and the telemedicine initiative. That is also the part of that. Then emergency and the risk management. We have listened to a lot of things of the disaster. So he is the one person who should know all these kind of things. He should conduct mock drills, the staff training, and the how the in the case of the disaster, how to evacuate the patient from the different area of the hospital. All these kind of practices, all these kind of drills has to be conducted on the regular basis. And these are some new roles. So in the modern healthcare emerging role, change manager, he is so much equipped of himself, so that whatever the changes are there, just say right now the artificial intelligence there, if hospital manager they themselves are not convinced, or the have confidence in artificial intelligence, it becomes very difficult for them to make it implemented in the hospital. Health economist, he has some good knowledge, business acumen, how the services are cost effective, and the whatever the other options are there. Community social responsibility, he should work with the community. And sustainability lead means whatever the things we can sustain, we can practice of the green hospital, we can practice for this waste management. So these are all the, we can also practice for the rainwater harvesting. These are all the sustainability activities which the manager should take care of that. And these are the few challenges which are facing by managers in India. Clinical autonomy with the administrative control, that is one of the big issue to manage the doctor who are highly skilled in their job, and to make them into the administrative framework, it becomes very difficult. Many times there is a kind of tension, or some kind of strained relationship with the administration and the doctor. So it is very important how you are managing to that. Then managing resource constraint is a big challenge in India. This is one of the big problems. So this is very serious kind of responsibilities, or the area where the hospital manager should put his or her best effort. Then workforce shortage, burnout. Burnout means people start become fading out, frustrated by doing a continuous kind of one work. So you have to take care of this. A lot of burnout. For the burnout, to reduce the burnout, lot of welfare program. As a manager, you have to start in your hospital. You have to open some kind of wellness center in your hospital for your staff also, so that burnout can be reduced. Dealing with regulatory and accreditation present, that is also very big thing. Nowadays the hospital, they are competing so much, cut competition between among each other, so everybody is just focusing on the quality, and all these qualities they are being managed by this regulation and the accreditation. So that pressure is very high on the hospital manager. And maintain patient satisfaction is a very competitive market. That is one of the biggest challenge, where the hospital manager has to work a lot. But ultimately, whatever the technology, whatever the human resources, whatever the green hospital or yellow hospital, but ultimately final verdict is there. A patient who come visit your hospital, and when he leaves the hospital, if he is not satisfied, whatever things you have done, whatever infrastructure, whatever assets you have, that is all in vain. So patient satisfaction is a very big thing, and in this so much competitive world, or in so much competitive zone of this healthcare services in the India particular, it is a very challenging thing. But if you are a good manager, you have all kind of skills which I have mentioned, and you are able to use the skill, you are able to translate the skill into the field. Then of course this challenge is not a that kind of challenge. You can easily satisfy your patient, and you can sustain a market with good financial value, with good ethical kind of treatment, and with good branding of your corporate hospital in the entire India or in the entire world. Okay, so with that, I just finished this topic for the today.
Right, sir. Thank you, sir.
Thank you, thank you. Okay.
Good night, sir.